Dementia Positive. This is our business proposal for an integrated dementia screening and medicine use review plus service in Winchester. According to the World Health Organization, every 3 seconds in the world, someone is diagnosed with dementia. In the UK, there are currently 850,000 dementia patients. In just 6 years, this is expected to reach over 1 million, and then in 2051, it will increase to 2 million. This is a public health priority, as stated by the Prime Minister's challenge. This challenge sets out to improve diagnosis rates in 2020. Why is this such a big national target? Because early diagnosis of dementia can improve the quality of life for dementia patients. A timely diagnosis could mean timely treatment methods, and possibly a delay in disease progression. This can minimize the impact of disease progression on the patient, the caregivers, the NHS, and the economy.
Winchester City Council is one of 11 district councils in Hampshire. In 2009, the Winchester district had the third highest number of people with a formal diagnosis of dementia in Hampshire. These numbers are expected to increase significantly. Despite the high number of diagnoses, it is estimated that more than half of dementia cases are undiagnosed. Therefore, these figures could be much larger. Early diagnosis is listed as a key priority for Winchester. This can help manage the effect these numbers will have. But is the effect really that bad? Dementia costs the NHS £26 billion a year. This figure is expected to almost double by 2050. The ageing population means more cases are very likely to be observed. On average, according to the Chief Executive of Alzheimer's Society, it can take up to 5 visits to the GP before being diagnosed. This is simply not good enough. A late diagnosis can be devastating for people. It could mean an increase in hospital admissions, comorbidities such as depression, and productivity loss. Taking time off work due to dementia in the UK amounts to a loss of £29 million a year. Not only does Winchester have high cases of undiagnosed dementia, less than half of those that are diagnosed will adhere to medication. Dementia Positive involves 3 services hoping to be commissioned by the Clinical Commissioning Group. We are utilising community pharmacies because they are a relaxed environment, less stigmatising and frequently visited by the public. The first service is training of the workforce using the Dementia Friendly programme. The second service is pre-screening of dementia using the mini cognitive test. And the third service is an enhanced medication review or patient-centred medicine consultation for those that are diagnosed. Training is important to meet targets and raise awareness. It will be good for continuing professional development, CPD. This will be done in a mixture of online and face-to-face training via events. This training will be reviewed annually for any updates. The mini cognitive test is a short 3-minute memory recall test. It is approved by NICE and once again will help meet national and Winchester targets. It will be carried out by pharmacists using standard operating procedures, SOPs, and involves the identification of high-risk patients in the pharmacy. This test will be reviewed in focus groups every 3 months and surveys filled in by participants. You could save an average of £4,850 per diagnosed patient a year using early assessments. The MUR Plus is aimed to increase adherence, de-prescribe inappropriate medication and reduce medicine wastage. This will be carried out by the pharmacist. They will have mock sessions to practice with observed by dementia specialists. This service will be reviewed the same way as a mini cognitive test. A random controlled trial published in the British Medical Journal showed better outcomes such as fewer drugs prescribed and better savings with a pharmacist-led review. We hope to replicate these results. This flowchart shows how we will be implementing our services. It will first be piloted with pharmacists working within a GP surgery to facilitate ease of referral. And then this feedback will be collected and applied to the first cohort of community pharmacies. The Dementia Positive service aims to utilise the pharmacy workforce in dementia care and increase job satisfaction. It will decrease the GP workload and encourage collaboration between healthcare professionals, especially when it comes to referral from the mini cognitive tests. It will help increase diagnosis rates of dementia within Winchester and manage behavioural and psychological symptoms with the MUR+. We hope our service can improve the quality of life with dementia patients in Winchester. In the future, we can introduce Dementia Positive services to more community pharmacies within Hampshire. Thank you for listening to the business proposal.